Let's have a frank and direct conversation about men's sexual health after the age of 60. Today we're talking about masturbation, not as a taboo subject, but as a crucial component of your overall health and well-being. For too long, this topic has been met with silence or uncertainty, leaving good men without the information they need. That ends today. I'm Dr. Eleanor Vance, and as a urologist, I believe that clear, expert knowledge is the key to living a healthy and confident life at any age. In this video, I am going to give you a medically sound guide to this vital aspect of your health. We will cover the practical techniques for masturbating safely, the common and potentially harmful mistakes to avoid, and most importantly, the clear warning signs that tell you it's time to speak with a doctor. This is the straightforward advice you've been looking for, designed to give you clarity and the agency to manage your own health. Let's begin. We're going to structure our conversation today into 3 essential parts. First, the 5 core principles of safe self-pleasure after 60. Second, the common mistakes that can cause physical or psychological harm. And third, the critical red flags that mean it's time to seek medical help. Your body at 65 is not the same as it was at 25. This reality requires a new approach, one based on wisdom and patience, not just youthful vigor. Principle number 1, listen to your body's new language. After 60, your erections might be less firm, take longer to achieve, and require more direct stimulation. This is a normal result of natural changes in blood flow and nerve sensitivity. Fighting this or getting frustrated is counterproductive. Stress is a well-known erection killer. Instead, practice patience. Your body is speaking a quieter, more nuanced language. Listen to it. Explore what feels good to you now, not just what you remember from decades ago. Principle number 2, lubrication is your best friend. This is absolutely non-negotiable. With age, the skin of the penis becomes thinner, drier, and produces less of its own natural oils due to hormonal changes. Without adequate lubrication, friction can easily lead to chafing, painful microtears, and infections. Invest in a high-quality, water-based lubricant. Avoid products with perfumes or novelty additives. Apply it generously. This single step is paramount for ensuring comfort and preventing injury. Principle number 3, create a sanctuary, not a racetrack. Privacy and true relaxation are vital for arousal. If you're worried about being interrupted or are trying to finish quickly, your body remains in a state of stress, which physically prevents the parasympathetic response needed for an erection. Find a time and place where you can be completely relaxed. This act is for your well-being. Treat it with that level of respect. This is not a youthful indulgence. It's a legitimate form of proactive self-care. Principle number 4, it's about the journey, not just the destination. Many men are conditioned to believe orgasm is the only valid goal. After 60, it's incredibly beneficial to release that performance pressure. Shift your focus from a goal-based event to a sensory-based experience. Slow down. Explore different types of touch. The journey of arousal itself is what promotes healthy blood flow and maintains nerve function. This regular, low-pressure activity keeps the intricate network of blood vessels flexible and responsive. It truly is like physical therapy for your sexual health. Principle number 5, engage your most powerful sex organ, your brain. Sexual response is deeply psychological. If your mind is filled with anxiety about performance, outdated shame, or stress, your body will absolutely follow its lead. Use this time to connect with your own body in a positive, accepting way. Focus on the physical sensations and practice mindfulness. For many men, this reduces stress, improves mood, and provides a tangible sense of vitality and control, which is deeply empowering. Now that we have the principles, let's talk about the pitfalls. These are common mistakes that can lead to physical and emotional problems. Mistake number 1, the death grip. Many men develop a very firm, specific grip over the years, which inadvertently trains the penis to only respond to that one type of intense pressure. This can lead to delayed ejaculation and can make partnered sex less satisfying, as other forms of stimulation may feel inadequate. The fix is to consciously vary your grip, use a lighter touch, and use lubricant to retrain your nerve endings to appreciate a broader spectrum of sensation. Mistake number 2: ignoring basic hygiene. It's a simple point, but it's crucial. Always masturbate with clean hands and on a clean penis to drastically reduce the risk of introducing bacteria that can cause a urinary tract infection or balanitis, which is an inflammation of the glands. Wash before and after. It's a simple rule for a powerful reason. Mistake number 3: forcing an erection. If an erection isn't cooperating, do not get aggressive or try to bend or force the penis into rigidity. A semi-erect penis is much more vulnerable to injury. Forcing it can damage delicate vascular tissue and potentially lead to Peyronie's disease, a condition where scar tissue forms, causing a painful curved erection. If it isn't happening, don't force it. Health is the priority, always. Mistake number 4: using unsafe tools or lubricants. I must be very clear here. Only ever use items specifically designed for sexual stimulation. Household objects can break, have sharp edges, or harbor bacteria, causing severe injury. Equally, do not use soap, lotion, or petroleum jelly as lubricant. These products can strip natural oils, disrupt the pH balance, and cause severe irritation. Water-based lubricant is the medical gold standard. Mistake number 5: viewing it through a lens of shame. This might be the most damaging mistake of all. Shame leads to avoidance, rushing, and ignoring safety precautions. Acknowledging that this is a normal, healthy, and medically beneficial act is the foundational step to doing it safely and gaining the maximum benefit to your well-being. This next section is not to scare you, it is to empower you. Your body sends signals when something requires attention. Do not ignore these red flags. Red flag number 1: persistent pain. This isn't minor chafing. This is significant pain during arousal, ejaculation, or a persistent, deep ache in the penis, testicles, or perineum. It could signal infection, inflammation, or a structural issue like Peyronie's disease. See your doctor. Red flag number 2: blood in your semen or urine. Seeing blood, called hematospermia or hematuria, always warrants a medical visit. While the cause is often minor, ruling out serious conditions early is the key to effective treatment and peace of mind. Therefore, do not panic, but do not delay in making an appointment. Red flag number 3: significant and consistent changes in your erection. A sudden inability to get an erection or the development of a new and painful curve is a major signal. Severe erectile dysfunction can be an early warning for cardiovascular disease. A new curve could be Peyronie's disease. See your doctor to investigate the change and check your heart health. Red flag number 4: any new lumps, bumps, or sores. Perform self-exams regularly. Look for new growths, hard lumps on your testicles, or sores that won't heal on the skin of your penis or scrotum. While most are benign, they can be signs of an STI or, rarely, cancer. Any new or changing lesion must be examined by a physician. Red flag number 5: a drastic and unexplained drop in libido. It's normal for sex drive to gently decrease with age. It is not normal for it to suddenly fall off a cliff. This can be a sign of low testosterone, a thyroid problem, clinical depression, or a medication side effect. Talk to your doctor. These conditions are often highly treatable. We've covered the new instructions, the common pitfalls, and the essential warning signs. This isn't a one-time lesson. It's an ongoing healthy dialogue with your own body. The principles of listening to your body, prioritizing safety, releasing performance pressure, and knowing when to ask for help. These are principles for aging with dignity, health, and vitality. Your sexuality doesn't have an expiration date. It simply evolves. By embracing it with knowledge and without shame, you are taking an active, powerful role in your own health journey, ensuring that your later years are defined by wellness and self-respect. Thank you for trusting me with your time today. Be well, be safe, and be good to yourself. If you found this conversation helpful, please like this video and subscribe. Share it with a friend or a brother who might benefit from this message. It's how we break the silence together. The information in this video is for educational purposes only and should not replace professional medical advice. If you have specific questions or concerns about your health, please consult a qualified healthcare provider.